views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello and welcome to Open, the show opening the Bronx and the rest of the world to you. I'm Veronica Guity, filling in for Darren Jaime, and today we'll update you on what's happening in and around our borough and New York City. Coming up, we'll sit with attorney and host of today's verdict, David Lesch, to discuss laws affecting our community. Afterwards, we'll speak with a representative from the Pediatric Infectious Diseases at Stony Brook Children's Hospital to give us more information about the coronavirus. And we'll learn how one cancer clinical trial is being improved for minority and undeserved communities. Later, February's American Heart Month, we'll speak with a cardiologist on how to know if you're at risk for a heart attack. After that, the ADCA Symphony Orchestra will be hosting its third concert of their X-Concert season, celebrating Dominican music. More details later on in the show. Then we'll speak with the producer and host of a talk show that provides a voice to the LGBTQ community. So stay tuned. All this and much more is headed your way because we are now officially open. Hello everyone, I'm Veronica Guity, filling in for Darren Jaime, and today is Wednesday, February 26th, and you are now watching Open, a live program bringing the Bronx and New York City straight to you. We also want to welcome our viewers on the Manhattan Neighborhood Network, as Open is being broadcasted simultaneously on MNN's channels. You can stay connected to us on all social media platforms at BronxNet TV. Some things have been going on through this past week. We'll take you through it with Bronx Updates. On Monday, February 24th, a new rule went into effect, possibly making it difficult for immigrants to obtain green cards. Green card applicants will have to prove that they would not be a public charge. Under the admissibility on public charge grounds policy, immigrants who rely on benefits or are considered likely to rely on the benefits, including Medicaid, food stamps, housing vouchers, and supplemental security income, will be affected. Immigration officials will use a set of factors, including age and income, to determine whether a person's application should be denied. A statement from the mayor's office says it's important to note that the eligibility of public benefits has not changed, and many immigrants are not affected by public charge. Don't stop using public benefits unnecessarily. Non-U.S. citizens who are already permanent residents will not be affected. In other news, New York State Senator Alessandra Biaggi visited Lehman College to announce a $340,000 in capital funding for a new composting education center. Our BronxNet reporter Sanji Lopez has more details.
New York State Senator Alessandra Biaggi and Lehman College President Daniel Lemons announced the allocation of $340,000 in capital funding for a new composting education center on the Lehman College campus.
This composting center is going to allow for not only Lehman College to be a leader in the fight against, climate change and the fight for climate justice, but it's going to make sure that the borough actually has the leadership it needs in this regard.
Part of what we'll do with the center as we expand it is we're going to increase our education program. So that will be for the public, it will be for children, for adults.
As a leader in sustainable business practices, Lehman College began composting its waste in 1996. This funding will be used to organize and expand the college's already existing composting infrastructure in order to reduce the amount of food scraps and gardening waste sent to city landfills, in partnership with the New York City Compost Project and the New York Botanical Garden.
We've been dreaming big about this for a very long time, and something as simple as purchasing equipment that is more efficient and creating a more organized site has a lot more benefits than just operations. It creates something that the community can see and understand.
It would help us a lot because it would help students learn more about composting, giving back to the earth. It will help us better plant more nutritious plants, more nutritious anything, gardening.
Even participating in a food scrap drop-off in the neighborhood is important. It's such an easy way to have a really big impact.
Senator Biaggi wrapped up her speech with a message on the climate crisis and how one green step here at Lehman College in the Bronx can help address this issue globally.
Every single inch matters, and all of those inches add up to make sure that we can actually make a meaningful difference, not only in the borough of the Bronx or the state of New York or the United States of America, but in this entire world, because every single one of us plays a very important role, a very powerful role in making sure that we actually protect this planet to pass it on for generations to come.
Reporting for BronxNet, Sanji Lopez.
Thank you, Sanji. That's all for Bronx Updates. We have to take a quick break, but when we return, Attorney David Lesch will inform us about laws affecting the community. Stay tuned.
Praise the Lord. I'm Evangelist Barbara Mayo. I have a program called The Great God. I come on every Saturday at 3:30, channel 70 and 36 on Files. You need to catch me because it's a program to encourage, to lift up, and if you don't know anybody that haven't heard about the program, tell them about it. They'll be encouraged, for God is good. God bless you.
Thank you for staying with us. ICE has significantly increased its presence in courthouses, arresting individuals suspected to be in the country illegally. What are laws behind these actions? Also, with the passing of the cash bail reform, many individuals are pushing to change the laws on cash bail. How will it affect our community? Here to give us more information and provide further insight is attorney and host of today's verdict, David Lesch. Hey, David.
Nice to see you. It's always a pleasure.
Always a pleasure to see you.
It's really great. All right, so let's start with ICE. 1,700%, that's the increase in the amount of arrests that have been made as a result of a directive that ICE has been following, where they've been going to the different courthouses throughout the city of New York and in New York State as well, and they have been looking for undocumented illegal aliens who've either been accused of crimes or are there for particular reasons, and they've been arresting them either at the courthouse itself or many times across the street.
So how do they know? What are they looking for?
All right, so let's take a step back here. Yeah. So you have to understand that our set of laws really comes through 500 years of common law. And one of the first laws that we took as a country was a privilege that allowed individuals to be able to go in and out of courthouses without repercussion, and we did that, and we took that as our law back in late 1700s, and we codified it and took the common law because we wanted people to be able to litigate their disputes and not be afraid to go there and bring witnesses, because if a witness was afraid to go to the courthouse, then you couldn't use that witness to show that you lent somebody else money, and then you couldn't have your day in court, and then the judge would postpone the hearing or the trial, and these were things that happened 300-400 years ago. Well, we took that as a privilege, and we continued it as a society, and we really never thought to put it codify it into any type of statute, because it's nothing that really has come up in the last 200 and something years.
And also just common decency. You're going into the courthouse for one thing. You don't expect to be arrested.
Exactly.
Who
would expect that in our society that you would be going into a courthouse and you'd be arrested? It's not something you'd think about. But unfortunately, now with the push, the immigration issues that are coming up in our country, ICE has this directive. So what have we done? Well, the Supreme Kings County, the prosecutor's office, has brought an action against the federal government, in particular ICE, to make sure to keep them out of the courthouses because it's preventing them from being able to prosecute their crimes. Witnesses do not want to show. Well, what happens when witnesses do not want to show? Well, what ends up happening, you can't get a conviction. Well, you can't get a conviction, what happens next? Unfortunately, the people who are on the street who have been convicted, who are accused of crimes, are still being accused of crimes. You can't put them in jail. So it's hindering their ability to prosecute a case. That's the first thing. The second thing is, again, it's streamlining the judicial process. If you end up having to put over cases because people are afraid to come to court, well, judges have to move hearings. Costs New York State more money. So we, as New York State, have an interest to prevent this directive, not only because it infringes on those who individual rights, whether of the immigration and the aliens who are going there, but also for taxpayers who are paying for money for the judicial system, extra money that normally wouldn't be there. So that is our right to hopefully be able to dismiss this particular directive. So,
and I just want to point out that all of the people who are going there, those who are being targeted, are not all going there because they were there for crimes. Like you said, some of them are witnesses to a case.
So the Office of Court Administration, that's the New York State office that runs the court system, has basically issued its own directive. You have to stay a certain amount of feet or yards away from being able to arrest somebody from the courthouse. Well, ICE basically just ignores it, and if they do it, they end up in plain clothes, in unmarked cars. They know who's going to be in the courthouse.
They're kidnapping these people.
They grab them really quickly. Yeah. So, all right. So let's pretty much tell you where we are at this point. So the motion, ICE brought a motion to dismiss the cause of action that was brought by the district attorney's office. And we opposed it. In other words, the district attorney's office opposed it, and the judge did not dismiss the case, which means it's now ongoing, which means in federal court, fairly soon, we should have a decision, hopefully, as to whether or not ICE has a right to be anywhere near the courthouses, or does that common law 500-year-old precedent still stand? But even if we do have a decision, which we probably will be getting, it's going to be appealed. Probably have a decision in the next 6 months. It's still going to be appealed, and you know that eventually it's going to get up to the United States Supreme Court, because that's where this issue has to go. Because remember, fundamentally, it's the right of the federal government versus the right of the state government, and that's really what federalism is. Do we have a right to keep the federal government out of our courthouses? Right. Federal government says we have a right to protect our nation from illegal, undocumented aliens. Who wins?
So for those who are undocumented, if they get called to be a witness, I mean, they have a real fear.
Sure do.
What can they do? Not
much. There's really not much they can do. What can you say? Try and skirt the law by coming in and out of courthouses where they shouldn't go? Judges have been arrested for doing that, for trying to hide witnesses and having them go out different areas of the courthouse. They've gotten in trouble for that. So it's unsettled. It's hard for me or anyone to really tell you what they should or should not do. I mean, hopefully you go in there, you go and you give your testimony, and no one's there for you. But it's really a very shocking situation. And it's that privilege against courthouse civil arrests that is eventually going to get litigated, and we're going to find it out an answer, but it's not going to be today, and it's not going to be tomorrow. Quickly about the bail.
Yes.
All right. So.
We have 1 minute.
We have a minute. It's not very long.
So really about the bail, I know this is something that they've been trying to fight here in New York. Just tell us quickly what's going on. What's the highlight?
What's going on is it's only been a couple of months, but there are some groups that are up in arms that those low-level crimes that have been committed, no bail, letting the people out, and some of the groups are saying these crimes are being committed again. we don't have the statistics. We don't know exactly how many people are going out. With just the high-level offenses, you hear about it every once in a while in the news. Bail bondsmen are not particularly happy. It's their business. They liked giving bail bonds out and for bail. I mean, it affects them. So they're trying to go back up into Albany, tinker with the bill, see what happens. Of course, we're going to get, maybe the bill might have been rushed, initially, but it is the law now. So stay tuned. You got about another 6 months. We're going to find out whether or not judges are going to be given the discretion to basically say, look, you're dangerous, too dangerous. So I'm going to make my own opinion here, and we're going to make sure that I'm giving you bail. I don't care what the new law is. We'll see if the judges have the discretion.
All right, Dave. Thank you so much for being here.
Always good seeing you.
You too. If you need answers and advice to difficult legal issues, you can always connect with David on Facebook and Twitter at Today's Verdict. And tune into Today's Verdict Tuesdays at 6:30 p.m. right here on BronxNet TV. Don't go anywhere, because when we come back, we'll learn more information about the coronavirus. Stay tuned.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
What's up, guys? It's your girl, The Essence, here, right on the set of the The Essence Show. Please tune in each and every Wednesday at 9 p.m. Files 34, Optimum 68, and live streaming BronxNet.tv. Or you better get in line.
With over 81,000 known cases of the coronavirus on the rise, there is a need to have better understanding on the virus and figure out the actions to prevent the virus. Joining us on the phone to tell us more is Division Chief of Pediatrics, Infectious Diseases, and Director of the Office of Clinical Trials, Dr. Sharon Nachman.
Good morning.
Good morning. How are you, Sharon?
Great. Thank you for inviting me today.
Thank you so much for being here with us today. So this is a real fear. We've been hearing so much about the coronavirus, about the rise. And right now we have 57 confirmed cases right here in the U.S. And if I'm not wrong, 81% of people have been affected by this?
Correct. So let's talk first a little bit about the virus. Mm-hmm. And then we'll talk a little bit about those populations of interest to me, which are often infants, children, and pregnant women. So let's talk about the virus first. Because this is a new virus or a novel coronavirus, that means none of us have ever seen this virus before. Mm-hmm. So it's not surprising that when people cough on each other or sneeze on each other, the second person who is a recipient of that sneeze or cough is going to get infected. That's not a surprise. We've never seen the virus before. Right. But that doesn't translate into those people who are acquiring the virus are all getting sick with symptoms. So while the numbers are quite high about how easy it is to pass from one person to the other, that doesn't necessarily translate that everyone who gets the virus is getting sick. So I want to inject a note of caution in that we see this happen with respiratory viruses every year in New York with the flu. People who have never seen that circulating virus, the flu, are susceptible, and we're all seeing it and catching it. As you know from your friends, not everyone is sick, and not everyone goes to the emergency room or the hospital, but they may have a respiratory illness or a cold or a little stuffy nose. A lot of the patients who are getting coronavirus are exactly that. They're having some mild respiratory symptoms, not going to the doctor or the hospital, and they're staying home. And that's the good news, because we don't think that this virus is causing as much significant serious illness as other coronaviruses that were new to our populations in the past, like SARS.
Okay,
we think it's a lot closer to the flu with reports of illness.
So I just want to make sure that I'm hearing correctly. So you're saying that if you are experiencing mild symptoms such as respiratory issues, shortness of breath, are you saying that they should stay home and try to rest and let it pass, or they should go into the emergency room?
So it depends on who they are and what their underlying illnesses are. So if they're a patient who has some other medical problems and they think they came into contact with someone who had coronavirus, they should start by calling their provider and figuring out, is it best to go to them or to an emergency room or some other medical provider situation. But the last thing they should do is just walk in someplace without a heads up first. Most of us on the hospital side will say, if you came into contact with someone with coronavirus, we don't want you going out to a hospital or emergency room without putting a mask on before you get here.
Well, how do you know if you have come into contact with someone with the virus?
Well, the answer is a lot of it has to do with who you're seeing and where they've been. So in New York, if you're just hanging out and doing your usual work, job, etc., we haven't seen any coronavirus here yet.
Okay.
So that means more likely than not, your illness symptoms are probably the circulating flu. The good news is we have great diagnostic tests that are cheap, easy, and fast. So if you think you have flu-like illness, you can get tested, and we can verify, yes, it's the flu.
Well, you know, the thing that's happening, I think every time we see a new strain come on the scene, people get very scared. They don't know what to do. Should I walk around with a mask? And, of course, people know about washing hands all the time. But, I mean, what security can you give to people about this virus? Should we continue doing? Or if people haven't, are there any new things that we should be putting into practice that we haven't done in the past?
So I think the first thing that you've asked me is about should we be wearing masks? And if you ride the subway and see people walking on the street and they're wearing the paper masks that we often see on television that surgeons are wearing, you need to understand that those paper masks are not effective after you've worn them for about 15, 20 minutes. They get wet, and when they get wet, they're not a barrier for anything, for anybody. So wearing a mask for the entire day or for the hour ride on the subway means that by the time you get off the subway, it's not effective anymore. And since I don't see people switching them every 15, 20 minutes or every half an hour, and they're wearing that same mask all day, it's probably not effective at all. So I think that mask that people are wearing, those paper masks, not so helpful. The second thing that you've asked me about is what precautions should we take? And I think those are the ones we talk about with every respiratory illness. Don't sneeze and cough on each other, and lots of good hand washing. And more than that, there's nothing else we can say. Some of the spread of this infection, like on the cruise ship, has to do with recirculated air and close contact. And those people were in close contact with recirculated air for days on end. So you can say they were sort of the recipients of passing the virus from one to the other to the other. We don't see that in regular work life because most of us, the windows are open, we're coming in, going out, so we're not seeing days of recirculated air. So I want to suggest to people that if they're just having a small respiratory illness, that's probably okay. But if they're having a lot of sneezing, coughing, and certainly fever, they should not be going to work and certainly not riding on the subway. But again, it all gets back to where are the cases and where's the spread. And in New York, we are not seeing the cases, and we're not, thank goodness, seeing any spread here yet. So I think we are still in the watch and wait mode.
Excellent. Well, Sharon, thank you so much for that insight. We really appreciate taking the time to be on the phone with us and to let our guests know the precautions that they can take to make sure that they are not getting the virus. So thank you so much. So for more information, you can visit cdc.org/GovID19, and you can also visit stonybrookmedicine.edu. Don't go anywhere because when we come back, we'll learn more about cancer clinical trials and proven cancer care for minority and underserved communities. Stay tuned. Thank you for staying with us. Montefiore and the University Hospital of Albert Einstein College of Medicine secured a $5.9 million grant to build on successes recruiting minorities and underserved populations into cancer clinical trials. However, the question is, how will cancer care be improved for minority and underserved communities? Joining us to tell us more is the professor of epidemiology and population health at Einstein and Montefiore, Dr. Bruce Rapkin. That is a tongue twister.
Hi. Thank you.
Thank you.
Thank you so much for having me here and for giving us a chance to talk about this.
We're excited to have you here because
thank
cancer, as we know, is a disease that has taken so many of our loved ones. And if we can find something that can give us more of a lifespan, then this is, tell us more about the trial here in the Bronx.
I mean, it's really important because cancer affects people of every stripe, every community, and every family.
Yeah.
And it's really, really important to have cancer research that improves treatments. For the treatments to be effective, what we've learned more and more, and it's become more and more evident over the years, is that the diversity of human populations really has to be factored into cancer research. So it's not just different types of cancer anymore, like breast cancer or colon cancer or lung cancer. It's what the biology of the cancer is and the biology of the person who has the cancer. So you may have heard of personalized medicine.
Yeah.
More and more, cancer treatment is moving toward a personalized or precision medicine approach. The idea is that you have to match the right treatment to the right person. And in order to do that, it's more important than ever that our clinical trials be representative to see what works best for whom. It's, you know, they always say one size does not fit all, and that's more true about cancer treatment than ever before.
Sorry, I was going to say, how are you going about choosing the patients for this trial?
Well, that's a great question. Every single clinical trial, this is a program that it brings multiple different kinds of trials to the Bronx. We're working with the National Cancer Institute and a network of researchers and cancer centers around the country. Our site was lucky to have been chosen, fortunate to have been chosen, to be one of 14 sites around the country working in minority and underserved communities. So we have a role in planning the research, deciding what kinds of studies are being done, making sure that they're the kinds of studies that are important for our community in a variety of ways. Not just around importance of racial and ethnic diversity, but also people's lifestyles, their diet, their comorbid illnesses, other things that they may be sick with that have to be taken into account so that the trials fit those people. When somebody has cancer, a specific type of cancer, the physicians and the team that they're working with would determine whether or not it's appropriate for them to be on a clinical trial. A lot of times there's treatments that will be tried first, and then they may be eligible for a trial later.
When you say treatments, are you talking about the
chemotherapy
standard treatments that
or
you've seen?
Yes.
Okay.
Yes. And so many times trials are trying to find a solution for people when there aren't other options. But other times there are trials that are in place to try and even improve on the standard of care. So every person's situation is different, and it really depends on what trials are going on. But we're working with the NCI to bring trials for almost every type of cancer and at every stage. So it's always important to ask, if you're a cancer patient, what might there be for me? One of my colleagues talks about the fact that really, in this day and age, cancer clinical trials should be considered part of the standard of care. When you're on a clinical trial, you know that you're getting treatment that's either the best available standard or something that, you know, might be better. The emphasis is on it might be better. It's research and we don't know, but it's a chance to find that out. And also you know that you're going to be monitored closely so that if any problems come up, whether they're symptoms, reactions to the treatment, the clinical team is there to provide that kind of support. That's always available, but on a clinical trial, it's really kind of scripted in to be sure that it happens.
Has this specific trial been tried in other states, or is this going to be the first time that it's being done right here in the Bronx?
A little history. We received a grant to begin this project and to build it up from the ground up back in 2014. And because of our successes over the last 5 years, we were able to get this larger renewal of the grant. And so it really has been ongoing, but now it's expanded. And it's expanded in a couple of ways. More trials, different types of studies that will come in, and also a focus not only on cancer treatment, but on improving people's access to cancer care. Also studies on cancer prevention and screening. So it really runs the gamut of different kinds of studies to improve health outcomes for people. One of the things that we've tried to do, for example, in our department of radiation oncology, we initiated a trial that's part of this where we're looking at people in our community who are having trouble making it into daily radiation treatment appointments because they get too sick to come in. And we've started to use a Garmin fitness step count device because one of our doctors found that when you see a drop in step count, that's like an early warning sign that somebody's going to start having trouble, so we can intervene early and help them to keep up their health enough to come in for the treatments and get the dose of the treatment that they need.
And intervening early is so key.
Yes.
Key
In every instance.
In everything.
Yes.
Well, Dr. Rapkin, thank you so much for being here with us. Good luck with these trials. It's something that our community definitely needs.
Thank you.
So thank you so much for joining us.
I'd be happy to come back and tell you about results of any of these.
We would love to. We would love to hear that.
Just one thing I wanted to say is if people have questions about cancer care, please visit our website, montefiore.org/cancer, so that they can find out. Anybody listening may have concerns, and there's help available.
Excellent. I believe we had that on our lower third. For more information, as Dr. Rapkin said, you can visit einstein.yu.edu, and you can also visit montefiore.org. We have to take a quick break, but coming up, we'll learn details about heart disease. Stay tuned. Welcome back. In the United States, someone has a heart attack every 40 seconds. What are the major risk factors of a heart attack? Is there anything you can do to know if you are at risk or anyone that you know is at risk? Joining us to tell us more is Dr. Leandro Slipchuk, cardiologist and director of cardiovascular. That's a really big one. And lipid disorder center at Montefiore Einstein Center for Heart Disease. Thank you so much for being here with us.
Thank you for having me.
I am having all these medical terms today, so these long words. So excuse the tongue twister. Thank you for joining us to tell us more about heart disease and what one can do to prevent themselves of having a heart attack and what can be done. I think most people always say, you know, if I'm exercising, if I'm, eating right, then that's enough. Is it enough?
Let's go back and start with what a heart attack is.
Okay.
So the heart is a pump that just brings blood to the rest of the body. And in order to function, it needs its own blood that is blocked by the coronary arteries. So atherosclerosis is a disease where these cholesterol plaques can accumulate in these arteries, and according to different risk factors, these plaques can rupture, and that causes a blockage in your arteries. When the blood doesn't get to the heart part of the heart dies, and that's called a heart attack. And that's very common, like you said, and it's the number one killer in this country.
And it's still, I would think that, with all the information that we've had through the years about heart disease, that the numbers will actually decrease. But are they staying the same? Have they increased?
Yeah, there's some improvement in the treatment, in particular of heart disease, but it's very important to detect it early, and once you have a heart attack, to prevent a second heart attack from happening. So it's very important to know the main risk factors for a heart attack. Some of these are high blood pressure, hypertension, that it's very important and very undetected, because you can have high blood pressure and not know about it because you may not feel it.
Which is also hereditary, right?
It has a hereditary component, yeah, and then it's related to another one, that is obesity and to high salty food and to what we eat. The other one is cholesterol. So if you have very high cholesterol, that can accumulate in the arteries. And a particular one in this case could be genetic, like you're saying, and it's called familial hypercholesterolemia. That is a genetic disorder that increases the cholesterol very, very high. The other one is diabetes. That is when the blood sugar is high in your blood. And that's very important to screen for as well, because you may have high blood sugar and not realize about it. And then obesity, that is very common, especially in our community, and lack of physical activity and diet and smoking. Those are the main risk factors that are important to know.
So what is Montefiore doing to make sure that our community knows their information and, all the preventive measures that they can take to make sure that they don't get a heart attack?
Sure. So, this is a teamwork that is not only by cardiologists, so it's very important, and we have a lot of doctors, PCPs, internal medicine doctors, cardiologists, endocrinologists. But right now we created a new program that is called cardiometabolic program. The importance of this is that some patients have multiple of these risk factors going on, and we know by recent data that it's not uncommon to have these risk factors not well controlled, even after a heart attack. So we created this clinic, cardiometabolic clinic, where we have an endocrinologist, we have a pediatric cardiologist, we have a heart failure specialist and transplant specialist, a chronic kidney disease specialist, and myself. The idea is that these patients could be complex, and in this way, someone can come to the clinic and see a different specialist on the same visit, and then we come with a plan all together to provide better care.
And this is covered by most insurance?
Yes,
by
absolutely.
most health insurance?
Absolutely, yeah.
So talk more about the clinic. Is it going to be at all Montefiore hospitals here in the Bronx, or is it just at a specific location?
So the clinic is starting at Hatch, at the Hutchinson campus.
Okay.
And the idea is that with time it will expand. Because as we know, in this community, we have a lot of diabetes, a lot of obesity, a lot of heart disease. But it's very important to detect these risk factors, to control them, especially if you had a heart attack or if you have extremely high cholesterol with a family history of a heart attack. We provide also genetic testing where we can see if the problem is genetic, and then your family can be screened. That's the idea of having a pediatrician working with us as well. So if you have something called familial hypercholesterolemia, where your cholesterol is very high, especially if the bad cholesterol is above 190, you should be thinking you may have a genetic component of it. And then we test a gene, and your whole family can be screened. So it's important for early detection and treatment.
What can someone do right now to improve their cardiovascular health?
So first is knowing your risk factors, right, like we were talking about. Then knowing your numbers. So you should know if your risk factors are controlled or not. And then the other thing that we can do is, traditionally we've used these scores that we use based on population studies to know if you're at risk. We have looked at thousands of patients and then taken the risk factors into account and see who is at high risk. The problem is that certain communities, in particular Hispanic communities, have not been well represented in many of these trials. So another option that we have is called calcium score, where we do a CAT scan of your heart. and then we can see if you have plaque that is forming in your heart, and then treat it accordingly. This is mostly important if you never had a heart attack and if you are in the intermediate risk, and it's a cheap test that provides a lot of information.
Excellent. Dr. Slipchuk, thank you so much for being here with us.
Thank you for having me.
Thank you. For more information, you can visit their website at montefiore.org or call 646-670-5120. Don't go anywhere, because when we come back, we'll learn about a concert celebrating Dominican music. Stay tuned.
It's time to get serious about your future. At Bronx Community College, you can earn an Associate of Applied Science degree and become a medical laboratory technician in as little as 2 years. Earn an average salary of over $50,000 a year in one of the most rewarding careers in medicine. All you need is a high school diploma or equivalent to get started. Those who qualify can get tuition covered by grants and scholarships, so why wait? For program details, contact Bronx Community College today.
Thank you for staying with us. February 27th is Dominican Independence Day. In celebration of this day, the Association of Dominican Classical Artists will be hosting its third concert of their X-Concert season, entitled Celebration of Dominican Music with Dante Cucurulo. Our open host, Darren Jaime, got a chance to speak with the executive and artistic director about their upcoming concert. Let's take a look.
And thank you, Veronica. Here now to tell us more is the executive and artistic director of ADCA, Aiden Vasquez. And thank you so much for being with us.
Thank you for having me again. This is a pleasure.
Obviously.
So we are celebrating our Dominican music, symphonic Dominican music, and it will be tomorrow, Thursday the 27th, at Aaron Davis Hall City College. This is part of a concert series that we have. We have 6 concerts per year, and this one, which is exactly on the day of the Dominican National Independence, it will be, as I said before, symphonic music from the art, celebration of Dominican composers.
When we talk about Dominican music, give us a little bit about it, because people who may not be familiar with the Dominican culture, very rich, very profound history.
Well, what we are trying to do is just to show that we are more than bachata and merengue. We celebrate that too. But we also try to become, be a window, if you may say that, to show off that Dominicans have other type of music too, including folklore music, like the concert we did in October, which was basically Gaga, Balsier, from the countryside. This is more academic music, if you may say, symphonic music, with elements of Afro-Dominican elements included on that. Yeah.
And so some of the guest people we'll be hearing from?
Say that again?
The guest people we'll be hearing from?
We're going to have Dante Cucurulo, one of the main composers, still alive. He will be conducting, and we're going to be doing a premiere of his music on that day too. Yeah.
And so for the music that's going to be heard, people say, listen, I hear Dominican music, we talked about bachata and all of that, right? But when you talk about symphony, how popular is it back home?
It's not that popular. It will be like kind of jazz here among, the minorities community. That will be kind of an elite, if you may say that, although I hate those terms. But yeah, it's more intellectual, but people like it. Once they go, once they see, once they sit down and they enjoy, to see merengue being played by violins, and the perspective change.
Right.
Totally.
And you're with the Association of Dominican Classical Artists, right? So
yes.
Talk to us about that.
Yes. It was an association founded in 1980 by a group of Dominicans that wanted to show a different side of the Dominican community.
Right.
During a period of time where, the Dominican community didn't have a very good reputation. in the 80s, and they were doing one concert per year at Carnegie Hall. The first president, she passed, and then I became the person in charge. But I have a different vision. Instead of bringing the Dominican culture to Carnegie Hall, I wanted to show off our culture in our neighborhood and then bring New York City to Washington Heights and to Harlem. So we became residents of the Adam Davis Hall Theater, and we have 6 concerts per year on that theater. And what we do, we are trying to showcase different type of Dominican music plus Latino music, symphony music, and also the kids from our conservatory. But we want people coming to our neighborhood. We don't want to take our neighborhood, our talent out of the neighborhood. We want to show off what we do inside the neighborhood.
Right. And you got a special concert coming up in April as well, right?
Yes, it's the end of the concert series, but we also have, I forgot to mention that, the one in April, which is the kids from the music conservatory that we have. There will be like 135 kids performing on stage. We also have, besides the concert series, we have a conservatory that we are taking kids from age 6 to age 18. And the idea is to form, the next musicians of the symphony orchestra. Kids from the community, totally free.
Right.
We don't charge.
And kids in orchestra, right? We hear about them in school, band, this and that. How important do you think music is from an early start, having that influence in, elementary school all the way through high school?
I believe, as a musician myself and as a music teacher, without music or the arts, there is no way that you can explore curiosity. And you need curiosity. And you need curiosity to become a scientist. So without the arts, you won't have that. Unfortunately, the Department of Education, one of the first things that they have when there are cuts, one of the first things that they remove is the arts. So with that in mind, we decide to open a music school in the community, totally free, for kids that have talent, but they are playing violin. So, 6-year-old kids playing violin, cello, harp, viola, and playing in group, making music, creating music, composing music, performing in front of the audience. And without that, I think what we will have is more gang members, more kids dropping out of school, lack of curiosity, lack of intellectuality. So we are there for that.
Yeah. And so when you talk about, kids and being empowered, what is the hope? As you continue to work with them, develop their skills, is there hope that you want to, as you said, create this next generation?
Yeah, the whole idea is to have a symphony orchestra formed by kids from, Washington Heights and Harlem and the Bronx. Kids that look like me. And the thing is, very interesting, the members of the symphony orchestra are the teachers at the conservatory. And our main purpose is to show our kids that somebody that look like them, a black Latino, I'm a harpist. And then I have 10 kids that want to be harpists because, the person that is playing the harp and the violin look like them. Right. Oftentimes, when I take my students to Carnegie Hall to see a performance, none of these people look like us.
Right.
So
you giving them a vision. Thank you so much, Angel.
Pleasure.
Good to have you. All right, listen, want to let you know the celebration of Dominican music with Dante Cucurulo. I want to make sure I got it right. Cucurulo will take place tomorrow, February 27th, from 7 to 9:30 p.m. at City College's Center for the Arts and the Marian Anderson Theater, located at 129 Convent Avenue on the 135th Street entrance. Now, if you want to RSVP for the event, you can also visit ADCA at eventbrite.com. And for more information, you can always visit the website adca.nyc. We're taking a quick break, and we've got more open coming up right after this.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at bronxnet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back. Out Loud is a talk show giving a voice to the Bronx LGBTQ plus community and telling the Bronx their stories. Joining us to tell us more is producer and host of Out Loud, Anthony Parker. Anthony, see, I told you I was going to butcher your name.
Thanks for having
Hump
me.
Day has been crazy today.
Yes.
So thank you for joining us. You are an Access producer here with BronxNet, right?
Yes.
How long have you been an Access producer?
I have been an Access producer for about a year now.
Excellent. So you took the studio production class.
Yes.
I love to see people who want to get their information out there come and take advantage of the classes we have here at BronxNet and put their show out there. You didn't waste any time.
No, yes, and I'm thankful to BronxNet for giving me the platform to do so.
So tell us about the show. Out Loud is the name. Why did you decide to name it that? And what are some of the topics that you're covering?
Sure. Well, Out Loud is just, I think the title goes along with the show, just living like out loud and, you know, yourself, really. And it gives a voice to the LGBT community, which was something that I felt that was lacking, and aims to make people aware of the different resources that are available locally and the safe spaces. And we have, you know, and create conversation too around issues that impact the LGBTQ plus community. And we have on artists and performers, so it's a fun time too.
So what inspired you to do this, to say, you know what, I'm going to be the voice of change. I'm going to make sure that I'm providing this platform.
Yeah, well, I felt that a voice was lacking here in the Bronx, specifically for the LGBT community, and I am passionate about my community too. And I went to school for film production, so it's kind of been a blending of two of my passions, really.
And what have you learned so far? I mean, I'm sure in your research and trying to provide the information, what are some of the resources that you've found here in the Bronx that are helping the community?
Yes, it has been a learning experience for me too. I have learned about a lot of the history of the LGBT community here in the Bronx. We've had on in the first episode of the show, Bronx Academy of Arts and Dance, otherwise known as BAD.
And BAD has been in the community
for so long.
Yeah.
And they've really been a consistent safe place for the LGBT community. I've learned just about the history through them too. We've also had on the New York Transgender Bodybuilding Federation, so we brought in the conversation about the trans community too with them. So I've learned a lot about the resources, but also even more about my community worldwide and locally too.
I mean, I love that. So now you've had season 1.
Yes.
And now season 2 is coming up.
Yes.
What can we expect for season 2?
Well, in the first episode of the show, I said that the community really does exist so far beyond just the L, the G, the B, and the T, and that's so true. So I am continuing the show's mission of really telling everyone's story in the community, the story this season. And, you know, I want to make sure that everyone's voice is heard. In the first episode airing next week, we have the editor of the Riverdale Press, Michael Hinman, who is going to talk about the LGBT community and how it's covered in the news. And then we have on a performer, a recording artist named Robert Garcia, who has a really inspiring life story, who has experienced homelessness and things like that due to being LGBT. And they're going to have a performance for us too. So I'm excited for it. I'm excited for everyone to see it.
What's your story? Because you were talking about, you know, this gentleman, but I'm sure you have a story as well. You know, what message do you want to make sure? Are you the host of the show?
Yes, I am.
So what message would you like to give to the community?
You know, one thing with this show too, I want to, maybe someone who is struggling at home with understanding things about themselves, maybe they see the show and, you know, it sparks an interest in learning more about themselves, or helps them understand themselves better. And maybe there's people outside of the community who don't understand certain things. And I want to, you know, maybe hopefully have them learn something too by seeing the show. So yeah, that's really my message of just, like I say in the show many times, we're all humans at the end of the day. And I want, you know, everyone to understand that we're all the same, you know.
Excellent. So when does it air? Mondays at 7:30, correct?
Yes, that's our new time slot. Yep.
Mondays, and tell us where we can catch it. Are you streaming as well?
Yes. Well, it will be on, you know, on BronxNet on the BX Omni channel, and then it is available on YouTube the following day.
Excellent. And any more information that you would like to give to the audience?
Yeah, so we have a website too, outloudtalk.com, where you can stay up to date with all things Out Loud. And if there's anyone who would like to come on the show and share their story or the work that they're doing for the LGBT community here, they can submit using the Be on the Show tab at the top of our website.
Excellent. Anthony, thank you so much
Thank
for joining
you for having
us.
me.
Really appreciate it.
Thank you.
Out Loud's new time slot, as Anthony mentioned, is at 7:30 p.m. on BX Omni on Optimum Channel 68 or Verizon Fios Channel 34. The new season begins Monday, March 2nd. For more information, you can visit their website at outloudtalk.com, and you can also follow them on Instagram at outloudtv.tv. We've come to the end of our show today. I'd like to thank all of our guests for joining us and you, the viewers, for tuning in. If you missed any part of today's show, you can catch the recablecast at 5 and 10 p.m. on Optimum Channel 67, Verizon Fios 33, or watch anytime on the web at bronxnet.org. You can catch a brand new episode of Open with Rena Valentine on Friday. That wraps it up for us here on the set of Open. I'm Veronica Guity, and remember to keep this channel wide open and to always let your light shine.